Adversity is a natural part of life. Just as the butterfly must struggle to emerge from its cocoon to break away and spread its wings, our children must face challenges that shape who they will become. But for many, the setbacks and frustrations of childhood and adolescence result in fear, anxiety, and many times psychiatric illness and the stigma that is too often attached.
20% of all children up to the age of 18 will experience a psychiatric illness before their 18th birthday. Of those children, about a quarter, 25%, will actually experience an illness that's more severe or becomes chronic. The good news about this is that psychiatric illness is always treatable. It's often curable, and sometimes it's even preventable. The problem that we have is that only 20% of these kids are actually having the opportunity to be evaluated and treated by a psychiatrist. The rest of them are having to get treatment from their pediatrician, from school counselors.
Out of all the kids that I see in one day, I would say at least a third of those kids in one day have some kind of mental health issue that I need to address.
I've been in practice here for 20 years, and over those 20 years, the amount of mental health concerns and care that we provide as pediatricians has increased an incredible amount. And the resources have been scarce.
We're steadfast in our commitment to continue to grow and develop and support, 1, education, 2, treatment, and 3, better outcomes for all of those who are affected by this illness.
The demand for emergency room consultations has grown pretty dramatically in the last 5 years, and just from last year to this, there were probably about 400 consultations to child psychiatry in the emergency department in 2013. And just in the first quarter of 2014, we've had 200 consultations.
One of the key words that we use in our clinic is resilience, and it's really a central part of our programming and how we think about working with patients. We don't want parents to sort of protect their children from failure. We actually think failure is a very useful tool to be able to grow and get stronger. So we help normalize failure, normalize adversity, and actually make that a part of the growing process so that they get stronger over time. And so celebrating that and normalizing that with families can be very effective in terms of building resilience.
So every time there is a psychiatric symptom or a full-blown psychiatric illness, I think it's important for us to remember and to also remind parents that there's opportunity in that. We have opportunity to take that setback, face it, manage it, and master it. It's a part of building great mental health. They have to face setbacks. We all do.
I'm Leela McCain, the mother of Karen Douglas, who I lost to suicide in October 2013. It's really hard to be an adolescent these days, and many times families will end up in the hospital in a crisis. You know, one day they're a happy family, everything's just fine, and the next day they're in a major crisis, and the first point of contact is a hospital. To know now that someone can go to Newton-Wellesley Hospital and have the full array of services and to be adequately oriented in this very complicated, mental health industry, so to speak, that we have, will be a huge help. Huge.
The fact that I can just call them and have help is just so essential to my practice and allows me to be a better pediatrician and offer better care to these families and to these kids and get them the help that they need.
People are very afraid to talk about mental illness because it's something you can't see. If someone breaks their arm, everyone wants, to run over and sign the cast. But if someone says they're depressed, or they suffer from anxiety or bipolar, they really don't know what to do and they run the other way.
This has all led to a crisis in this country and in our community of completely untreated psychiatric problems. This is a crisis because families are suffering, children are dying, and this is completely preventable.
A lot of hospitals are doing away with their adolescent psychiatry programs. And at this particular time, Newton-Wellesley is trying to increase the size and increase the strength of our program. And I think that's really unique in our community. I don't know of any other hospital that has such an amazing, robust child and adolescent psychiatry program as Newton-Wellesley.
I'd like to thank all of you for the support you have given us in the past. We're facing serious budget constraints in the future. And we would ask you to continue to support us. Our children and their families are depending on you. Thank you.